Hi guys, my name is Rebecca Ransom and I am another member of the Essential Living team, and I'm here to talk to you about comfort measures that you can take during pregnancy and labor and during the season of nursing after you give birth to your baby. I am a mom to 3 babies. I've had an oily pregnancy and oily childbirth, and I am also a natural childbirth instructor, and I regularly use oils while nursing my now 8-month-old. I am not a doctor, and I would encourage you to bring any of your medical concerns to your care provider and discuss anything that you decide to do, any regimen that you decide to use, oily regimen, anything like that. Run it by your care provider before you do it. I highly encourage that, specifically while you're pregnant or when you're nursing. That said, when we talk about oils, just to reiterate, we're only talking about Young Living oils. I'm only talking about Young Living oils, therapeutic grade oils that have been rigorously tested and are consumed by thousands worldwide. If you're pregnant or nursing, a good rule of thumb is to limit any ingestion of oils to maximum of 3 to 4 drops per day, unless you're suffering from acute illness. And again, run that by your care provider before you decide to jump into any regimen like that. The first up to talk about is Ninja Red. Taking 1 to 3 ounces per day as a nutritional supplement is great while you're pregnant or nursing. For energy support, to avoid constipation, to help regulate blood pressure. Another great one for overall immune system support is the Life 5 probiotic. Also really great to support your overall bowel function, proper bowel function, constipation, and all of that to keep yourself healthy too while you're pregnant, not getting sick. Next one, for overall relaxation when you're pregnant, comfort while you're pregnant, lavender. Shocker, the Swiss Army knife of oils. Really, really great for itchy skin. I use this with a combination of lemon and Melaleuca A when I contracted mastitis for the 2nd time post-baby, and I used a combination of that also with oregano orally, and my mastitis was history after that. So I highly recommend the lavender, at least having it on hand, both during pregnancy, labor, childbirth, and afterwards while you're nursing and just while you're raising a tiny human being. Lavender is pretty fantastic. The next one would be lemon, helpful for heartburn, putting a couple drops in water. I would drink that for heartburn. I drink it for relieving my swollen feet once I got a little bit further into pregnancy and your feet get swollen. Really great for coughs, energy, overall congestion, any congestion that you might have. Frankincense and joy, I used both for my baby blues post-baby, and a little bit more than just baby blues, falling into the category of postpartum depression. Also, frankincense is really great for your perineum, stretching and prepping your perineum. Has really great skin properties for skin health, overall skin health. So rubbing this into your perineum is really great to prevent tearing before your baby's born. Peppermint in water can, I used it for heartburn as well, and also for nausea, just sniffing the bottle. Backaches, gas, bloating, hemorrhoids, the real deal when you're pregnant, and a bigger deal after you have a baby. The next one was Valor. Backaches for relaxation during labor again, spinal alignment and stress. Chiropractor in a bottle, really fantastic while you're pregnant, while you're nursing, and post-baby. Peace and calming, another great one. You can put in your bath while you're laboring. It's great leading up to that while you're pregnant, just overall relaxation in general, for your mental clarity, things like that. Cough, trouble sleeping, specifically even post-baby, if you were able, maybe recovering from a C-section, peace and calming could be great for that. Lavender diffused in or mixed into a body butter or massage oil could be really great for comfort measure if you want, maybe even gifting it to a pregnant mom in your life. Copaiba is really great as well for any and all inflammation. Keeping it around for teething babies is really fantastic also. Swollen feet, massage with copaiba and peppermint oil. Fantastic combination. A few oils to avoid or use with caution during pregnancy: basil, calamus, cassia, clary sage. Clary sage is great to induce labor, but you don't want to induce labor unless you're ready to go into labor. Cinnamon bark, fennel, hyssop, jasmine, juniper, myrrh, nutmeg, rosemary, sage, Idaho tansy, tarragon, Thieves, Digest, Exodus 2, Imu Power, Endoflex, Sklar Essence, Purification, Melrose, Aromaseas, Abundance, Into the Future, Dragon Time, M-Grain, Energy, and Clarity. That said, there are quite a few of those blends that I mentioned that I actually chose to use while I was pregnant. I did my research and I chose to use those over medications that could have been prescribed to me. So do your research, talk with your care provider. And then a couple things to consider while you're breastfeeding are milk supply and quality of milk. Peppermint and clary sage are known to diminish milk supply, while fennel and celery seed have been shown to increase your supply. I have great success with fennel specifically for my supply. Not to ingest more than 3 to 4 drops of oil per day, and ingesting with caution while you're nursing, because essential oils can cause a detox effect and toxins could be excreted into breast milk. Something to consider, keep in mind. That's why while you're nursing, it's not a time to begin to cleanse. All those toxins could be released into your breast milk. As always, do your own research, ask friends who've successfully used oils during pregnancy and while nursing, and then decide how you feel comfortable. Thanks for listening. I hope you have a great rest of the class.